Welcome to our PEBC exam practice question number 4. Here is our case scenario. A pharmacy technician is assisting a patient who is picking up a prescription for warfarin 5 mg. The patient mentions concerns about dietary restrictions and potential interactions. The technician, without consulting the pharmacist, provides detailed counseling about foods to avoid and how to monitor the signs of bleeding. However, the technician inadvertently provides inaccurate information, such as recommending high dose of vitamin K to counteract potential bleeding. The pharmacist later learns about the interaction when the patient calls with follow-up question about the advice. So, let's see what is our question number 1. What should the pharmacist do immediately upon discovering the situation? Option A. Contact the patient to correct the misinformation and explain the importance of consulting the pharmacist for such advice. Option B. Report the pharmacy technician to the regulatory authority without addressing the issue directly. Option C. Apologize to the patient but avoid correcting the technician to maintain workplace harmony. Option D. Ignore the situation as the technician's advice was given in good faith. Let's think about the answer. Here, the correct answer is option A. Correcting misinformation immediately protects patient safety. Informing the patient ensures they receive accurate information and restores trust in the pharmacy. Next is our follow-up question number 1. What steps should the pharmacy manager take to address the situation and prevent future occurrences? Option A. Prohibit pharmacy technicians from speaking to patients about any medications. Option B. Provide comprehensive training on the scope of practice for pharmacy technicians. Option C. Discipline the technician immediately without offering further training. Option D. Allow technicians to continue providing counseling but monitor them more closely. Let's think about the answer. Here, correct answer is option B. Training ensures pharmacy technicians understand their roles and limitations, reducing the risk of similar errors in future. Here is our question number 2. What part of this scenario demonstrates that the pharmacy technician acted outside their scope of practice? Option A. The technician provided incorrect information about warfarin. Option B. The technician engaged in detailed counseling without consulting the pharmacist. Option C. The technician assisted the patient without pharmacist oversight. Option D. The technician handled a prescription for warfarin which is not allowed. Let's think about the answer. Here, the correct answer is option B. Pharmacy technicians are not authorized to provide detailed counseling on medication, particularly high-risk drugs like warfarin. This task is the responsibility of the pharmacist. Let's see what is our follow-up question number 2. What are the potential legal or professional consequences of a pharmacy technician providing counseling outside their scope of practice? Option A. The pharmacy technician may face disciplinary action from their regulatory bodies. Option B. The pharmacy may be liable for harm caused by incorrect advice. Option C. The pharmacist could be held accountable for failing to supervise appropriately. Option D. all of the above. Let's think about the answer. Here, the correct answer is option D, all of the above. All parties involved, like technician, pharmacist, and the pharmacy, can face consequences if scope of practice guidelines are not followed. Thank you for watching our video. If you found this information helpful, please like, share, and subscribe our YouTube channel for further updates. See you then. Bye.